Good morning, everyone. Welcome. Today, we're going to talk about something that truly matters, first aid. This isn't about making you a paramedic or a doctor by the end of this session. It's about giving you the confidence to act in those critical first few minutes after an accident or a sudden illness, because what you do in that time can absolutely save a life. So, let's start with the basics. What is first aid? It's the immediate assistance or care you give to someone who is injured or taken ill suddenly, before the professionals can get there. Think of it as the first response. Its main goals are simple but powerful: to preserve life, to prevent the condition from getting worse, and to promote recovery. These are often called the 3 Ps. Your first priority is always to keep the person alive, which might mean starting CPR. Then, you work to prevent their injury from worsening, like by not moving someone who might have a broken bone. And finally, you promote recovery by offering comfort and basic care. Now, before you even touch the injured person, there is one golden rule you must always follow. Check the scene for safety. Is there traffic? Is there a fire? Is there a downed electrical wire? You cannot help anyone if you become a casualty yourself. So always ask yourself, is it safe for me to approach? Once you know it's safe, you can check on the person. Gently tap them and ask, "Are you okay?" If they don't respond, you need to check if they are breathing. This is where the ABC rule comes in. A is for airway. Is it clear? B is for breathing. Look, listen, and feel for breaths. And C is for circulation. If there's no pulse, you start CPR immediately. And while you're doing this, or better yet, before you start, call for emergency help. In Pakistan, that number is 1122. When you call, be ready to tell them your exact location, what happened, and how many people are injured. Let's talk about one of the most critical skills, CPR, or Cardiopulmonary Resuscitation. This is for when someone's heart has stopped. You start by checking if they are responsive. If not, call for help. Then, place the heel of one hand in the center of the chest, put your other hand on top, and push down hard and fast, about 2 inches deep, at a rate of 100 to 120 compressions per minute. If you're trained, you can give 2 rescue breaths after every 30 compressions. The key is to not stop until help arrives or the person starts to breathe on their own. Remember the story of the footballer Christian Eriksen, who collapsed on the field in 2021? It was the immediate CPR and the use of a defibrillator by the medical team that saved his life. For other common situations, the principles are straightforward. If someone is bleeding severely, your main job is to stop the blood from leaving their body. Apply firm, direct pressure on the wound with a clean cloth or gauze. If the cloth soaks through, don't remove it. Add another layer on top. Elevate the wound if you can. For burns, the correct action is to cool the burn under cool, running water for at least 10 to 20 minutes. Do not, and I repeat, do not put butter, toothpaste, or ice on a burn. These old wives' tales can trap the heat and make the damage much worse. Just cool running water. If you think someone is choking, they might clutch their throat and be unable to speak or cough. If they can't breathe, you need to act fast. Stand behind them. Give 5 firm back blows between the shoulder blades. If that doesn't work, stand behind them. Place a fist above their navel, grab it with your other hand, and pull inwards and upwards. These are abdominal thrusts, or the Heimlich maneuver. Alternate between 5 back blows and 5 abdominal thrusts until the object is dislodged or they become unconscious. Another serious condition is shock. This isn't just being startled. It's a life-threatening condition where the body isn't getting enough oxygenated blood. The person may look pale, feel cold and clammy, and seem confused or dizzy. If you see this, lay the person down on their back and elevate their legs, unless you suspect a head or spinal injury. Keep them warm with a blanket and reassure them. Do not give them anything to eat or drink. Now, it's just as important to know what not to do. One of the biggest mistakes is moving a person unnecessarily, especially if you think they might have a spinal or neck injury. Unless they are in immediate danger, like from a fire, keep them still and wait for professionals. Another common error is using dirty materials on a wound, which can cause infection. Always try to use something clean. And please, never delay calling for help. Don't assume it will get better on its own. It is always better for professional help to be on its way. Finally, all this knowledge is useless without the right tools. A well-maintained first aid kit is essential. Check it every few months to make sure nothing has expired and that all supplies are there. Keep it in a known easy-to-access place at home, at work, and in your car. Remember, first aid knowledge fades if you don't use it. It's a good idea to take a refresher course every couple of years to keep your skills sharp. What you learn today could make you someone's hero tomorrow. You have the power to preserve life, prevent suffering, and promote recovery. Thank you for your time. And are there any questions?